As we enter a new phase of the pandemic, we are going to be undertaking treatment in a new way, which is because the health of all our patients is just as important now as it ever has been. It's going to be very important that we prioritise our patients in terms of the treatment that they need and in respect of the number of patients who are currently awaiting treatment. So what we've decided to do is to adopt a traffic light system, or as some people may know, the RAG system, with red, amber and green. Now, the red patients are going to be our number one priority, and let's explain exactly what this means.
Our red group will involve patients who are suffering from severe toothache. They may be suffering from infection or swelling. They may have had an accident that resulted in dental trauma. There may also be other issues which the dentist may deem an emergency. All patients will be triaged and appointments arranged appropriately.
The second tier is the amber group, and this is reserved for patients who are awaiting treatment. You may have had an appointment cancelled as lockdown started, waiting to have treatment finished, such as your crown fitted, your denture fitted, or maybe implant treatment finished. And you will be recalled for an appointment to finish that treatment. But it's also for people who may have started treatment during the lockdown phase. If you had an appointment at the urgent dental care centre and you may have had a temporary dressing or your tooth opened and dressed, you may now need to have the root canal treatment finished or a permanent filling placed. It is also for patients who've had problems during the lockdown. For example, if you lost a crown, your denture is broken and you're awaiting to have these treatments finished.
The final category is the green category. That may be patients that are waiting for checkups, routine fillings, replacement crowns, replacement retainers or some types of brace. Unfortunately, as these types of treatments aren't urgent, you may be waiting a few months.
So we've dealt with our priority patients. So what about the rest of our patients? Well, what we're going to do is we're going to ask those people that are waiting for a checkup or waiting for a routine scale and polish to be a little bit patient. We will get round to them, but for the moment I'd like you just to wait, and we will perhaps put these appointments off for 2 to 3 months. What else can patients expect? Well, it will be different, and nobody will be invited in for an emergency visit without having first had a telephone triage. Once they're invited to attend the practice, they will come in and wait in the car park in their car. The nursing staff will come and get them from the car. They'll bring them into the practice, having first taken their temperature and sanitized their hands, and they'll be taken straight through to the surgery. When they're in the surgery, they'll be greeted by the dentist and the nurse, probably wearing PPE, which you might not expect. This will involve a mask, a visor, a hat, a gown and gloves. You must remember that this is for the health and safety of all our dental team and of course for yourselves.